Good day. My name is Dr. Ameti, a urologist. Today, I want us to discuss 7 points, 7 vital points I think can help you to go through surgical residency in Ghana. I know a lot of colleagues are in training. Some of them are thinking of entering the program, but those who are already in the program, how do you survive or negotiate the terrain in surgical residency? It can be a challenge. And every little advice, every little point that helps you to go through the various hurdles of surgical residency does make a difference. First point is to stay organized. And it's easier said than done. How do you stay organized? You first need to look at the whole course structure and look at the number of days. Count individual number of days you have to write your final exam. And then count all the topics that you have in your prescribed textbook. For instance, for us, it was the book we call Baja. Maybe yours is Bailey and Love. And surgery residents know these books in Ghana very well. So count all the topics that you have in these books and then spread them out over all the number of days assigned to you to prepare for surgical residency, leaving the, let's say, the last 4 months out of the count. So for instance, if you have, let's say, 3 years to do the program, count the days short of the months, the last 4 months that you have to write the exams, because those 4 months the learning is on a different level. It's high-speed reading, high-speed processing, recall, and if you haven't learned about 80-90% of what you need to know before those last 4 months or last 3 months of exams, probably you shouldn't be sitting the exams. All right. So after counting the topics that you have in your prescribed textbooks, and that means the topics for practice, pathology, principles, operative surgery, all those topics. Then you spread them all over the number of days you have till exams. And when you do that, you should be able to calculate how much reading you should do each day, how many chapters you must cover each week. Now, it did really help me, because in the beginning, you thought 3 years is a lot. But then if you look at the volume of material you have to read, it's also quite a lot. And know that surgical residency is just not about reading or solving questions in the comfort of your house. No, you have to go to work. You need to be in consulting rooms, join rounds, prepare cases for theater. You need to do presentations. You need to take part in mock exams. All that. And no one particularly will assign time to you for reading and mastering the craft as well. So it means that whilst we are discussing all the challenges of surgical residency, the time you need to prepare for theater, go to consulting room, come to the ward to do reviews, join ward rounds, after ward rounds, how the changes you need to make, and all that must be factored into this general timetable you have to read and master the theory in order to go write the exams. So that's how it is. Now, practically speaking, when I did that during membership and as well as fellowship, it gave me a rough idea as to how to keep pace with the academic stuff that I have to read. So I knew that for every week, there was a particular topic that I needed to read and catch up. And then if I was doing I was reading ahead of schedule, then it gave me the opportunity to go back and review certain topics that probably I have not read too well. So that is one way of organizing the time in order to master or be able to cover the topics that is necessary for you to prepare yourself adequately to write the exam. That being said, you also need a specific timetable that helps you to deal with the topics assigned you. You know, besides the syllabus that you have spread over all the days, preparing you for the main exam, you will also be given topics to prepare and present. This will be the journals club, will be in the textbooks. You may have to present at theater, during ward rounds, and all that. Because you cannot make excuses for your non-availability to do presentations on the wards or theater. You cannot say that because you are spending time doing your own reading. It's important to apportion time for these topics that has been assigned to you, the residents. It could be a topic that has been given to you by, for instance, your supervising consultant, your chief resident, or something may come up in group discussion, and then you are tasked to go read and prepare and come and present to the rest of the team. So you need to make extra time for that too. So that's really does take a great deal of your time. It's important to also prepare in advance for each day what you are about doing on the wards, consulting room, as well as in theater. For instance, you need to know the number of cases for your team, their diagnosis. You need to know the ones that need critical attention. And you must have thought of a plan for these cases before you come out of your place of residence and enter the hospital. When you come with a plan as to how you are going to review cases, whose labs you have to chase, cases that you need to update your bosses on about. If you know the timetable, for instance, the operating timetable, cases that you have booked, which ones you may have to assist, then it means that you have to read on the relevant anatomy and operative surgery and post-op care on those cases, because expect to be asked questions on such cases. As for residents, it's very disappointing to turn up in theater and have no idea about the relevant anatomy, the access, exposure, the critical steps that will be deployed in operating certain cases on the day of surgery. Your boss will consider you not to be serious. So anytime there is a theater list, you need to know it in advance, master it, be very much involved in the preparation of the cases. There is nothing disappointing than to be asked about specific questions concerning the patients. For instance, their imaging. You must have look at their images. Because you are the resident and you take active part in preparing these patients, the assumption is that you know everything about the patients. You may be lucky to have house officers in the team, and a lot of the heavy lifting, the chasing of labs, going for images, is assigned to house officers. So that may make you a little bit too relaxed. And you may come up short when it comes to knowing the facts about your cases at your fingertips. But that shouldn't happen. It has happened to me a few times, and it's quite embarrassing when questions come up about your case, the case you are trying to assist, and you have no idea about certain details. So that really does help you to get around theater questions and answer sessions. Okay. Then the second point is to develop a support system. Now, among your peers, it's very possible to know, to appreciate that some individuals may be smarter than you. Somebody might be very well informed on certain topics than yourself. You need to know how to tap into their strengths. You need to also build a good relationship